Can you guys hear me okay?
Yes, you sound great.
Okay, perfect. So I want to discuss fluoroquinolone toxicity, the hidden diagnosis affecting millions of people worldwide. Fluoroquinolones were introduced about over 30 years ago with Cipro. Bayer introduced the antibiotic Cipro. It was used extensively in the Gulf War. It's also led to many veterans with Gulf War syndrome have been exacerbated by taking the antibiotic Cipro for about 30 to 40 days, and many of them have consumed that antibiotic for that long. That's when this all really started, and then the hidden dangers have been coming to light in the last couple of years. But more recently, in the last maybe 5 years, there's been so much media coverage about this that it's kind of undeniable now for doctors to not acknowledge it. I want to share my own personal story about how I got into making this my life goal and passion to help everyone with this condition. I was severely, pretty much paralyzed because I took a prescription of Cipro. That was back in January of 2017. I had it prescribed for a minor gut infection. And I thought, oh, well, I was in residency. We prescribe this all the time to women for 7 days. If everyone else can handle it, well, surely I should too. Well, my story made CBS News, and they did a feature on it where I basically became disabled and had to live my life out of a wheelchair. I wasn't able to go to work anymore and do what I'm really passionate about, and that's treating patients, as I'm sure everyone here can relate to that. So that was me after I took the antibiotic Cipro. I only took 3 pills, and it felt like a bomb went off in my body, where I had complete muscle atrophy, wasting. My body was completely wasting away. I had neuropathy all over. I had suicidal thoughts, severe anxiety, palpitations, burning throughout my whole skin. I mean, it would hurt to I couldn't even stand up. I was in so much excruciating pain. I really don't wish this upon anybody. But that was me, and that's how I would get around during that time. And I want to share a brief video of my calves so you guys can see. I was a 31-year-old, very athletic guy. I'd work out every day, play basketball, running a few miles a day. And this is what happened to my calves afterwards. So as you can see from the video, I was suffering from diffuse and severe muscle atrophy of my gastrocnemius muscle and the calves. It was very difficult to even stand up and walk. It felt as if your tendon was going to snap at any given moment, just standing up. So there's kind of the proof in there that can't be made up, and that was definitely caused by the antibiotic. Moving forward, I want to discuss what are fluoroquinolones. So these are fluoridated antibiotics, and that fluoride component, which is the F, it allows central nervous system access. This is how it treats conditions like meningitis, for example, and it can get into your central nervous system. Usually, it's used for common respiratory infections like ear infections. They have eye drops, ear drops, and more commonly UTIs. And if you think about it, UTIs are more common in females than males. I'm sure everybody would agree. And the prescription ratio of Cipro is about a 4-to-1 ratio of women compared to men. And if you actually look at the data, chronic fatigue syndrome is also a similar ratio. It's really no coincidence. It's because of this class of antibiotics playing a huge role in that. But other medications in this family include the Levaquin, Avelox, norfloxacin, and ofloxacin. In my opinion, Levaquin and Avelox cause much more damage than Cipro does, but I'll get into that a little later. So how do fluoroquinolones work? They inhibit DNA gyrase, or DNA topoisomerase II. So this changes the DNA structure of not only bacterial cells, but of your normal cells as well. So just because you think you're killing a bacterial cell, you're also penetrating normal healthy cells in your muscles, your tendons, your gut, and those cells are also being damaged and destroyed. Kind of went over the DNA Dryrace portion. DNA Dryrace is actually required for healthy cell production. If you look at the literature, the DNA Dryrace is required for ATP, right? So in order to make ATP processed within your cells, you need the DNA Dryrace to work properly. So it's been shown that fluoroquinolones are also potent iron chelators. So they kind of drag iron out of a cell. By doing so, these epigenetic changes can occur in your DNA, and they can inhibit enzymes that require iron as a cofactor. This can lead to problems within the cell and mitochondrial stress. What ends up happening after that, there's a series of complex chemical reactions, right? So how do you end up getting these free radicals? Well, the literature has shown fluoroquinolones can form perioxynitrites. Then you can get toxic aldehyde formation, leading to free radical damage and ultimately apoptosis, cell death. They also inhibit an enzyme called proline hydroxylase. And just by the name proline hydroxylase is required to create collagen. So if you think about it, the tendon damage that occurs is caused by an accumulation of proline hydroxylation inhibition. So you stop this enzyme here, proline hydroxylase. And proline is a building block for our tendons, which are a part of every muscle. If you read the black box warning, you read a warning of tendon rupture or tendon pain, tendinopathy. This is actually not a tendinitis that occurs. It's a tendinosis due to the inhibition of this enzyme and also the removal of iron and magnesium from the cells, leading to a weakened tendon structure. I hope that makes sense to everybody. Okay. So as I discussed, the proline is a building block of the tendons, which are part of every muscle. And when you get an accumulation of free radicals, you basically damage your mitochondrial DNA. So let's backtrack. The Cipro and Levaquin chelate magnesium out of a cell. They're iron chelators. They cause the epigenetic changes. They inhibit proline hydroxylation from occurring, so you can't really create new collagen fibers. And then you get damage to your mitochondrial DNA by creating free radicals and toxic aldehydes. All right, so next slide. Here we're going to talk about some of the more cellular damage occurring by fluoroquinolones. So, as I said, you get oxidative stress within the organelle, and you get this accumulation of mitochondrial DNA mutations. You get dysfunctional OXPHOS proteins, and then you can increase your superoxide. And superoxide is no good because it will lead to a vicious cycle of oxidative stress onto the cells. This is why there's really no test for, there's no lab test for fluoroquinolone toxicity, because you can't really test oxidative stress. You can't really test mitochondrial functioning. But this is what's happening on a cellular level, which is why patients look normal to the naked eye. But, they're flying all over the country, going everywhere, trying every treatment they can because there's actually something wrong with them. And I really want all the practitioners to realize that if they do see a patient that has had this antibiotic at any point in their life, complaining of symptoms, not in their head, they really have mitochondrial damage going on that they can't really explain because it's intracellular. All right. So what happens is you accelerate this DNA, the mutagenesis, and you further deteriorate your mitochondrial function. And when you block cellular growth and differentiation of cells, how can you recover from injury? And this is why patients, when they exercise after, they're sore for days and days and days because they don't have the capability of that cellular growth and differentiation. I'd love to talk about some of the neurological symptoms that occur after consuming a fluoroquinolone antibiotic. Very commonly in my practice, many patients complain of neurological symptoms like brain fog. They get anxiety, panic attacks, I mean, memory loss. These patients, they can't even read a book without realizing what they just read. They just completely forget and zone out. And that also happened to me in the beginning where I couldn't focus on anything. I had complete apathy. Nothing matters to you. You don't care about, you just lose care and feeling of anything and people you love around you. And a study actually found that fluoride is one of the most effective methods of blocking spontaneous and evoked action potentials onto pyramidal cells. This exerts a partial blockade of the GABA-A receptor. So GABA, as we know, it's like the calming receptor in the brain, okay? And it prevents the hyperpolarization of the neuron, thus leading to calming effects. So if we can't prevent the hyperpolarization, well, we can't get a calming effect. We're amped, we have insomnia, we have anxiety, we're completely stressed out. Our brain is going haywire, right? So let me continue this. You get this depression, anxiety, the paranoia. I've seen patients with hallucinations from this. They get into this psychosis where they become suicidal. And unfortunately, we've actually lost not our patients, but online in the forums, there's unfortunately been many patients who have ended up committing suicide after consuming this class of antibiotics that we've seen there. You get this nervousness, agitation, confusion, you forget names, you forget places you went to. So, I mean, all these are very, very real, and it's not just in somebody's head. It's caused by, the chemical reaction and displacement of that GABA receptor. So, more commonly are the body-wide symptoms, right? And that includes the muscle wasting, which was the video I showed you guys of my calves. You get the Achilles tendinosis. So remember, there's no actual inflammation occurring. The drug goes in and does its damage. It's like putting a blowtorch to your tendons. I mean, it's already done. You get the widespread tendon pain. Very common is joint popping. The joints don't necessarily have to hurt, but they will pop, and that can last for years after. Palpitations is a very common symptom, usually within the first 60 days, and that in literature has shown there are changes and increase of the QTC interval that can lead to that. Joint pain, blurry vision is very common, and overall body fatigue. And again, as I said, this Cipro and Levaquin, the class of fluoroquinolone antibiotics, are the #1 cause of chronic fatigue syndrome, in my medical opinion, based on what I've seen. So history, how do you diagnose this? In my opinion, this is one of the easiest diagnoses to do for a patient. I just ask the patient, hey, have you taken this class of antibiotics, right? And it's a cumulative effect. So the first treatment may be successful and not cause any side effects. But when you add more and more treatments, this can trigger the start of subtle symptoms as the toxicity builds. So it can be a gradual effect in many. Ask the patient too, hey, have you ever taken an NSAID like ibuprofen, Aleve, Advil? Have you ever consumed a steroid during or after your fluoroquinolone exposure? I've seen that 3/4 of my patients have either taken ibuprofen or a steroid, either with or after consuming a fluoroquinolone, which completely causes even worsening of the toxicity. And also ask them if they've had exposure to other fluoridated medications. And you want to make sure your medications you're taking don't have fluoride in them, because it'll cause the patient to relapse and they'll do much worse. I'll get into that in a later slide. Well, here's another one of our patients with fluoroquinolone-induced calf atrophy. This patient was a runner in the past, would run every day, and now all of a sudden completely has loss of her calf with full-blown atrophy. I also want to show you guys what fluoroquinolones can do to your reflexes. So very similar to, let's say, an ALS patient where you get hypersensitive reflexes, 4 out of 4 deep tendon reflexes. In the beginning phases, the majority of patients will have very hypersensitive reflexes, and you'll actually see their head jerk when you tap the reflex. I see this almost on a daily basis. But watch this video and check it out.
Hey, it's Dr. Galili. I'm here with our lovely patient, Julie, who's visiting from Ohio. She consumed Levaquin and has central nervous system damage. Let me show you a quick test on how to confirm this. Her reflexes are off the chart.
So that there's no relaxation point. The reflexes just keep going and going and going. And you see a head jerk. That's when you know it's affecting her systemically. So I want to share this slide with you guys for medications to avoid lifelong after fluoroquinolone exposure, right? So fluoroquinolones, obviously, steroids, like decadron is fluoridated. You can't have that. We've seen prednisone and all the other steroids causing severe tendon damage, and that puts you at risk of tendon rupture. Ibuprofen, Aleve, Celebrex, Mobic, these have to be completely avoided just due to the severe damage that they cause. Voltaren gel, letinensed gel, steroid creams. I mean, I've had patients relapse off using a steroid nasal spray. Antidepressants, they're fluoridated. You know, your fluoxetine, Paxil, Celexa, Prozac. You want to avoid these completely. It would cause worsening neurological symptoms. Statins like Crestor and Lipitor, these have fluoride in them. They will cause severe muscle damage to a patient who's already been exposed. Many of the PPIs are fluoridated. They'll lead to exacerbation of effects. Diflucan is a very common medication prescribed. You can see Diflucan, FLU. So FLU for fluoride. This is usually prescribed after Cipro to women who end up complaining of yeast infection. So it's a very common side effect is to have yeast overgrowth and candida overgrowth. So the women get this, and then boom, after the Diflucan, a bomb can go off in their body, and they feel the chronic fatigue and all those other symptoms I discussed. But it's the Cipro that initially led up to that. If they just use the Diflucan by itself, they likely would not have had those symptoms. Quinine found in tonic water. I've had patients relapse from just drinking gin and tonics. And vitamin B6 can actually worsen the neuropathy. So you want to avoid that in all supplements. So who do fluoroquinolones affect most commonly? Right? So there's a couple of different genetic mutations that I want to go over, which is MTHFR, methyl tetrahydrofolate reductase. That gene is vital in methylation, and it promotes healthy detox. You need this reaction for a process that converts homocysteine to methionine. And the body uses methionine to make proteins. Glutathione transferase are involved in the detoxification of harmful compounds. SOD is a superoxide dismutase, and that takes superoxide, which we discussed earlier, a byproduct of mitochondrial electron transport chain. And this function allows superoxide dismutase to clear reactive oxygen species, and that protects against cell death. And VDR is the vitamin D receptor, and we know vitamin D plays very important roles to maintain healthy bones and teeth, support healthy immune system, brain and nervous system, and to support lung function and cardiovascular health. From my experience, I've seen that patients who take ibuprofen with fluoroquinolones have a pretty bad reaction. Steroids is much worse, and if they take all three together, that's the severe patient where it's like all hell breaks loose. And these patients need a lot of care and treatment, and they're in a severe state of toxicity when you combine all three of these together. So I want to talk about how fluoroquinolones cause the damage. All right, fluoroquinolones basically block type 1 collagen synthesis, and the collagen then degrades. We talked about chelating iron out of cells, and we discussed the magnesium coming out of the tendon, leading to weakening of cells. So this is how it's occurring. We get malon dialdehyde formation. And malon dialdehydes are a highly reactive compound that occurs as an enol. It occurs naturally, and it's actually a marker for oxidative stress. We also get lipid peroxidation. So lipid peroxidation is the oxidative degradation of lipids. Free radicals steal an electron from your lipid in your cell membrane. This results in cell damage. So that process proceeds by a free radical chain reaction. There was a study done with mice And all mice treated with ciprofloxacin had lower grip strengths, reduced balance, and depressive behavior compared with the mice who didn't, right? And in a survey, 93 out of 94 respondents reported fluoroquinolone-associated events including anxiety, depression, insomnia, panic attacks, clouded thinking, depersonalization, suicidal thoughts, psychosis, nightmares, and impaired memory. So why would we want to prescribe an antibiotic where the majority of people report symptoms like this? And that's our poor mouse probably in the study. All right. Next point I want to get to, which is very important, is antibiotic use in general, the increased gut permeability. Now, this is mainly for all antibiotics, but the fluoroquinolones are the most noteworthy and causing the most damage. As you can see here, antibiotics will completely wipe out your normal colonic microbiome, right? So this will increase luminal protease. And proteases can actually lead to leaky gut by causing the gut damage, leading to that zonulin channel opening up and then allowing certain things to pass through. So there was a study done, and in this study, patients receiving the antibiotic Levaquin, this is specifically for Levaquin, showed an increased fecal protease activity. They also had a markedly reduced fecal microbiome. There was an increase in serine protease, okay, such as trypsin and chymotrypsin, which also increased. This led to an increase in the permeability, which in the normal wild-type mice lasted approximately 14 days. So in those 14 days, patients can develop possible food allergies and food sensitivities to the things that they're eating. So if you're eating things like gluten after Levaquin exposure and certain foods, well, if you have a leaky gut, you get a cross of any of those particles, then you have your immune system attacking. You could develop an antigen response and then develop food sensitivity to that food for a long time afterwards. So any type of food allergies, we also want to make sure we're exposed to Levaquin, we're exposed to antibiotics in the past. This is part of the same study. This is a different study actually. And I wanted to talk a little bit about colostrum. And a trial was first demonstrated that supplementing with bovine colostrum decreased and actually mostly restored normal values in two parameters. That was for intestinal permeability. And that was the lactulose mannitol ratio in the urine and the zonulin concentration in the stool. So this is the zonulin concentration. And as you can see, before colostrum and after colostrum, the zonulin concentration significantly increased. And as we know, zonulin is used to help close the gut membrane barrier and prevent leaky gut from occurring. And that's the colostrum that I recommend to all my patients with liposomal delivery to get in and help with the microbiome, help with the leaky gut, and promote the beneficial bacterial growth that we need. So I've definitely seen this help patients. And as you know, I'm a firm believer in the gut-brain axis, and a healthy gut will lead to a healthy brain. So you guys are probably wondering, what do you do with a patient? So there's certain labs I like to order. I want to get a renal function panel just to make sure their creatinine's okay and can handle any type of treatment. For males and females, a hormone panel. And I would say 100% of every male I've ever treated had very low testosterone levels, a low free testosterone, low total testosterone, and the majority have increased sex hormone binding globulins. So we believe that there is a link between fluoroquinolone exposure and severely low testosterone levels. My testosterone levels at the time I was poisoned were, my free testosterone was about 5.8 and my total was 180, which is very, very low, maybe level of a 90-year-old. I mean, it was crazy, and I've been seeing that ever since for the last 3 years. You want to get serum iron levels. Remember, they're iron chelators. I'd recommend getting an ANA because a lot of patients will have a positive ANA. It's more of a false positive, and I think it's due to the leaky gut, autoimmune disease ensuing. But a few months later, the patients will test for their ANA will be cleared and negative. Get a full thyroid panel, RNP antibody for mixed connective tissue disease. I like to measure IGF-1s because insulin growth factor will usually increase when your body undergoes severe injury and attack. You want to rebuild your muscle cells, so your body's pumping out more IGF-1. And that could be a marker of, hey, there's something going on, the IGF is high, your body's trying to compensate. Homocysteine is important. It's a marker for inflammation and methylation defects. So patients with that MTHFR gene mutation, certain type, will have elevated homocysteine levels. Now, a lot of doctors do this wrong, and they don't order the correct type of magnesium, which is red blood cell magnesium. Ordering a regular mag level won't really give you much. What you really want is the red blood cell magnesium. And histamine, right? So histamine is important because patients can get histamine intolerance due to reduced aldehyde dehydrogenase. So if that enzyme's not there, that you get toxic aldehyde formation, and you can have a histamine response, which could lead to allergies to certain foods or supplements that they take in the future. So there's really only one test that can kind of prove a patient has fluoroquinolone toxicity. It's not really necessary. I don't even recommend patients doing it because at the end of the day, we know we can get neuropathy from it, but that would be a skin punch biopsy of the lower extremities. Over 90% of patients who complain of being poisoned by fluoroquinolones actually show small fiber peripheral neuropathy. So if you look at the skin biopsy, here you can see the nerves, right? You see everything there. And in small fiber peripheral neuropathy, sensory neuropathy, those are gone. If you actually look at a patient's legs that have been damaged by the antibiotic, they have dry skin, loss of hair, shiny, and a crinkly appearance to the skin, possibly. It looks very similar to a type 1 diabetic that's had it for years. One thing I wanted to discuss was stem cells used for tendon repair. So, you know, I integrate stem cell therapy in my practice. I really feel it helped save my life. So reading all the literature and data about it, I spent months and months educating myself and learning from the best doctors all across the country, who I, really appreciate all the time that they gave me to really learn this and become one of the pioneers on the forefront of the future of medicine. But, mesenchymal stem cells, there are multiple studies showing how it can improve tendon repair. And a study showed an MCL in the knee treated with low-dose mesenchymal stem cells exhibited less inflammation and reduced number of macrophages. And the immune-mediated response by these mesenchymal stem cells during healing shows that these mesenchymal stem cells can program macrophages from this pro-inflammatory M1 state, which I have a photo in the next slide, to an anti-inflammatory M2 phenotype, which is incredible. And the way these MSCs work is due to their paracrine immunosuppressive effect. So they work on that paracrine system. They modulate the macrophage phenotypes from pro-inflammatory to anti-inflammatory. That comes up in a later slide. So you can't just use stem cells in the body, right? It's very important to optimize that body beforehand. You don't want to just give stem cells to a toxic environment, a toxic body. It doesn't make sense to me. I feel like you're changing the oil of your car, but you're not changing the filter. You have to change the filter as well. So I detox the patients. I optimize their mitochondrial health. I optimize central nervous system health. Obviously optimize gut health, which colostrum plays a role, and other supplements as well. Optimizing their mental health. And a very important key is getting these patients to think positive, because the mind is very, very, very important. And a positive mindset is one of the most important things in healing from any illness, whether it's fluoroquinolone toxicity or any other type of debilitating condition. You want to optimize hormone levels. A lot of males will have testosterone in the bottom 5th percentile for their age. And you want to try to detox the fluoride, because remember, fluoride's a neurotoxin and it stays in the body. It's very difficult to get out. So just kind of talking a little bit about stem cell therapy and how they work. When you have a disease or injury, stem cells travel to the damaged area. They can release substances that rebuild the types of cells needed for your body to heal, cytokines and growth factors. So, stem cell injections can take advantage of this regenerative ability. And this is that slide I was talking about for MSCs and tendon repair. Remember, you have this M1 macrophage that's pro-inflammatory. It produces free radicals. Free radicals are no good. This leads to scarring and fibrosis. So once that tendon starts to scar and gets fibrotic, it's very difficult to heal, especially the Achilles tendon, which already has a poor vascular supply, right? And you get apoptosis. So stem cells can convert this macrophage to M2, which is anti-inflammatory, leading to increased cell proliferation, increasing collagen production. Remember, we don't have collagen production from the fluoroquinolones. And that's used for wound repair, remodeling, regeneration, and angiogenesis, which is the creation of new blood vessels and new blood flow. And remember, places like the Achilles, which are severely injured, and your calves, you need that angiogenesis to increase blood flow and increase oxygenation. So this was me after Cipro. That was the one day I was able to go out and actually enjoy my day. Probably one of the only days I had a smile on my face for about 5 months. And I want to get into a few patients just to kind of show you what the drug did to them. I have hundreds of these, but I just chose a few of them randomly to show. This is Wendy. She was only 40 years old at the time, and she came in the back of a pickup truck, drove down about 900 miles all the way laying back in a pickup truck because she couldn't sit. Her hamstrings were just hurting her so much she couldn't sit down in a chair. But here we go.
Hi, Wendy. Walk toward me.
This is her before.
Hi, I'm Dr. Khalili's patient. I've been treated for about a week, and I haven't even done stem cell treatment yet, and the genes are not immune for me.
Wow. Wow, jump up again. It's amazing. Wow.
Okay, so we treated Wendy, and she was damaged for almost a year. Her life was taken away from her for about a year. And then 1 year after we treated her, she actually sent me this video, which was incredible, where that's her beautiful home, and that's her view, and she has this trampoline built in, and this is what she sent me.
Happy 1 year anniversary of my stem cells, May 4th, 2018. And I can scan now.
And we love that because she's so happy, and she inspired so many people with her personal journey. This is our patient, Jennifer, who this was really remarkable and incredible. She suffered from severe tremors. She could barely get a word out, had severe anxiety, she couldn't read. She's a teacher. She couldn't read sentences. She couldn't comprehend a lot going on at this time when she was poisoned by these antibiotics. But I want you to watch this remarkable improvement that she had.
Jennifer, walk toward me. Walk back around.
is after. So that's after a week.
Awesome.
And I'll show you one more.
Jennifer, walk toward me.
Oops. And here we go. This is a 60-year-old female patient who came in who was disabled from Fluoroquinolones from Cipro, and this is her just a week later. Top is her before, the bottom is her after.
Hi, I'm 1 week into treatment.
So she has more mobility in her legs now. We have a bunch of others, but I didn't put them in the lecture PowerPoint. They're on our website. But as you can see, she has severe tightness in her muscles. She can't really lift her leg up. She's using her cane. And now once you figure out that this is the actual culprit, and you can go ahead and try to fix the toxicity, their muscles can rebuild, their tendons rebuild, their mood uplifts, they feel better, and it's really life-changing.
Hi.
So we actually, our news story got to the LA Emmy Awards, and we finally were able to show, millions suffering for the last 30 years. The Emmy Awards provided us with that platform, and we were able to share our story. And this really helped a lot of people suffering with this condition because they're able to show their loved ones, their doctors, their family members that they're not making it up, and the antibiotics really did cause their symptoms and their complaints. So we're really happy about that. And then we were able to make it on the doctor's TV show where the host, Dr. Orden, actually was prescribed Levaquin, and he was in a boot for about 5 months. He wasn't getting any better. He had severe calf atrophy, and we were able to treat him and got him back up and running in about a month. And they aired an episode on his treatment, and we were able to discuss the dangers of these antibiotics, getting this to the mainstream media, and finally educating doctors around the world that there are other alternative options. So we're really proud of that. And I want to close off by saying in the last 3 years of treating patients with this condition, a little over 800 people that I've either talked on the phone or seen in person in the office, I've yet to see one patient actually show me a documented bacterial infection that was sensitive to a fluoroquinolone antibiotic. I'm currently 0 out of 800. So I can only imagine, and based on that number, I'd have to guesstimate that I would have to say no more than 5% of these prescriptions are actually written for a documented reason with justification. I would say about 95% of the prescriptions of antibiotic fluoroquinolones are not justified with doctors prescribing them. So I really want everyone to be careful and make sure they're prescribing it for the right reason, not just guessing, because there are other options to use that can be safer and not have these severe side effects occur. And that's it on my end. If 𝘾𝙊𝙉𝙉𝙀𝘾𝙏 want to jump in.
Excellent. Thank you, Dr. 𝘾𝙊𝙉, for a great presentation. It's now time for us to move into our Q&A session. As a reminder, to ask your questions, please use the chat box and hit send to submit your questions. And I've already received quite a few. So I'll get started with this one. Someone is asking about the colostrum product. What is the name of the product again, and can you talk a little bit more about it?
Oh, yeah, it's from Sovereign Laboratories. They have a professional colostrum. I really love things that are liposomal delivered because the liposomal delivered product can get through the gut and actually enter the cells and get to where it needs to go. All the studies show it protects and repairs stomach and GI tissues. It promotes beneficial bacterial growth. I actually wrote an article about how colostrum can reduce viral patient days in a hospital. So we use it a lot for our coronavirus patients. We give them high doses of colostrum to get them to recover a lot faster. And this is documented through scientific studies because it has great effects for antiviral. It provides anti-aging support, and it can stimulate skin repair and regrowth.
Thank you. And someone's asking, do you see patients virtually?
So it's very difficult because the patients who have these type of conditions, I have to treat in person only because we're doing, customized treatment for them. I have to go over labs, genetic profiles. There's so much involved. It's very difficult and very time consuming to do this over the phone. And you just got to jump into treatment. I mean, there's only so much you could tell a patient of what to do on their own in terms of diet, right? Changing their diet, avoiding things. A lot of things are self-explanatory. But at the end of the day, when it comes down to treatment, we have to treat the patients in person for us to get the optimal result of what we want.
Thank you. And another question, can it be associated with scleroderma?
Yeah, so patients who actually have underlying scleroderma, which is anti-SCL70 antibody, I believe, that's part of the mixed connective tissue diseases. Patients who have that should never be prescribed this antibiotic. Also, patients with Marfan syndrome shouldn't because they already have defects in the collagen elasticity. So I would not prescribe these antibiotics for those people. It will make their condition a lot worse.
Thank you. And someone else is asking, what if we don't have written records of past antibiotic use, like when children or several years ago and problems ensuing?
Yeah, with the kids, it's usually the eye drops or the ear drops. And the reason the doctors and the urgent cares and ERs prescribe them, the Cipro ear drops, I think you put in once a day, where the other ear drops you put 4 times a day. So they don't want to hear complaints from the mom, oh, I had to drip this in my kid's eye or ear 4 times in the day. So they just prescribe the Cipro because it's easier to do without realizing the long-term sequelae and side effects. You give that to a kid, it's going to lead, you're going to have side effects and consequences later on down the road. That kid's body's still developing. He's not even fully grown yet. That can have issues with bone, muscles, and tendons, and also neurological symptoms as well. So if you have kids that, ask the kids, find out, hey, were you given Cipro ear drops? The Cipro has Cipro and dexamethasone. Dexamethasone is fluoridated. Cipro is fluoridated. That's the worst combination you could give to anybody. I mean, those eardrops cause a lot of damage in the kid. And what's the kid going to say? You're going to believe a kid when he says, Mom, my muscles hurt, or I don't feel right, right? Then the mom takes the kid to a psychiatrist. Psychiatrist gives the kid some Ritalin. I mean, I see this happen on a daily basis.
Thank you. And another question, I'm curious about needing RBC Mg level rather than the regular Mg level in the blood. What does this show?
Yeah, so the red blood cell magnesium is a more accurate marker of your red blood cell magnesium within the cell. So I really want to know how much magnesium is within that cell, because you really have to saturate magnesium in the body. It's very important for cell recovery and optimization.
Thank you. And another question, if a fluoroquinolone, thank you, is absolutely indicated for indicated for a patient, is there any concurrent strategy to mitigate the side effects?
Oh yeah, that's a great question. They first have to make sure it's the only antibiotic that is going to work. Okay, first and foremost. And that rarely happens. There's usually something else you can use. But if need be, I would make sure magnesium is also given alongside, because you don't want to get the chelation of that magnesium occurring, and you want to protect the cells.
Thank you. And is there any correlation between the number of doses of a fluoroquinolone that a person takes and the severity of side effect symptoms?
So yes and no. It depends on a person's genetic makeup, and it depends if they're taking any concurrent medications with it. Some people, 1 pill of Cipro is all it takes, bomb goes off in their body. Other patients, it's a 3rd or 4th prescription. Some patients, I've taken it 2 times, but this time I took it with ibuprofen, or this time my doctor gave me a steroid like prednisone with it for my lung infection. Boom. So it varies, but there is a cumulative effect, meaning you could take Cipro 3 or 4 times, 4 years later get 1 dose of diflucan, which is the yeast medication, and then boom, bomb can go off in your body. Or you could take a dose of Flagyl, boom. So it's because you took the Cipro or Levaquin so many times, something else can then lead to worsening damage. That's what I'm trying to hammer home.
Thank you. And another question. Many surgical patients are given pre-op and post-op antibiotics. What would you advise these patients do after surgery to minimize any potential harm?
Oh yeah, this is a great question. A lot of patients get these antibiotics and they actually impair wound healing. They cause delays in the wound healing from their surgery. So it doesn't really make any sense to me. What I would do, get these patients on natural regimens. You don't necessarily have to give them a synthetic antibiotic. You'd have to consult with a functional medicine doctor, but every patient is different. I would use a functional medicine approach. There's things you could do like ozone. Ozone works great. It's natural, antibacterial, helps promote wound healing. Light therapy, LED therapy is great for that, for post-op wound healing, and possibly giving them IVs. IVs to boost their immunity.
Thank you. And do other halogens like iodine and chloride have protective effects from competitive binding?
Yeah, so iodine can potentially help displace fluoride off the receptor, but again, it's very tricky because you can't just go and dose yourself. You can end up getting hyperthyroidism. You can actually, if you do have Hashimoto's, you can worsen your Hashimoto's. You can actually increase the antibodies, your thyroglobulin, by giving too much iodine at once. So it must be done very carefully, strategically, and you must have your thyroid levels checked. But that's a great question.
Excellent. And another question, why is B6 not used for neuropathy in these cases?
I've seen patients, well, B6, synthetic B6 given through, let's say, a supplement or multivitamin can actually increase neurotoxicity. If you look at the research, B6 toxicity exists, and some patients have worsening of their neuropathic symptoms, increased deep tendon reflexes, increased anxiety, increased neuropathy when consuming B6. So I just advise patients who have been damaged by this class of antibiotics to avoid that.
Thank you. And can you go over the detox protocol again?
So it varies from patient to patient, and everyone's unique and different. Everyone has a different genetic profile. Everyone has different labs, male, female. Some patients react to things. You really have to do this. It's really a case-by-case basis. There's no definitive protocol for this. There's no same treatment for two people. One person might have similar treatment and react poorly to it and not do well with it. So that's why it's very tricky. And mitochondrial damage is a very difficult thing to treat. It takes a lot of experience, expertise, and it takes a lot of time and hand-holding with the patient. And sometimes you have to try things for them and see how it goes before you go and do more.
Thank you.